Hello everyone. Today we will talk about the applied aspect part that is associated with calcium homeostasis. So, regarding the applied aspect, there are three diseases: rickets, osteomalacia, and tetany. Let's discuss about these. First of all, rickets. What is rickets? Rickets, it is a metabolic disease in children. Why does it occur? Because of deficiency of vitamin D. And rickets, it grossly involves defective mineralization of the organic bone. Now, what are the causative factors for rickets? Decreased exposure to sunlight. We had discussed previously that sunlight, it is a source of vitamin D. Second source of vitamin D was from the diet. Obviously, whenever there will be dietary deficiency, there will be deficiency of vitamin D. Thirdly, if there is any abnormality in vitamin D and phosphate metabolism, it can also result in rickets. You can see the clinical features over here. First is frontal bossing of skull. Okay, you can see in this figure as well. Frontal bossing of skull and craniotapes. आपको एक हाथ दिख रहा है? Craniotapes. The membranous bones of the skull depressed by giving pressure over it. It gives the feeling of ping pong. Ping pong. Okay, that's why hand is shown. The clinician is compressing it just to assess the feeling and to diagnose rickets. Okay. Third is rickety rosary. Okay, you can see here rickety rosary. What does it mean? Beads present over the costochondral junction of the ribs. It is called as rickety rosary. Next, there is presence of knock knee and bowing of legs. Knock knee, evident in this figure, and bowing of legs, it is seen over here. The person can suffer from spinal deformities also like kyphosis or delayed dentition, flabby skin, protruding abdomen. All these features, they can be seen in the person who is suffering from rickets. Have a look over the radiographs also. How can we diagnose the condition? By looking at the x-rays. There is cupping and fraying of metaphyses with generalized osteopenia and whitening of physis. Classic display of rickets. Okay, this is the classic display. You can see here. It's a very beautiful x-ray. X-ray of wrist and chest, it will also show thickened epiphysis. But classic display, it is very beautifully shown over here. Now, this is again a very beautiful flow chart to show about the types of rickets. First type is nutritional rickets. Nutrition means vitamin D. Whenever there is deficiency of vitamin D, the condition will be labeled as nutritional rickets. Second category is of vitamin D dependent rickets. See, I had shown you beautifully in this flow chart. Many people, they get confused with type 1, type 2, vitamin D resistant. This is the clear cut picture representing the type of rickets. Vitamin D dependent rickets. उसके अंदर दो parts है, type 1 and type 2. So type 1, it is autosomal recessive and it occurs because of mutation in the gene for renal 1-alpha hydroxylase. And what was the role of this 1-alpha hydroxylase? We discussed the same thing when I was telling you about the synthesis of vitamin D. Okay, 1-alpha hydroxylase, it is present in the kidneys, and this enzyme plays a pivotal role in the conversion of 25-hydroxycholecalciferol or calcidiol into 1,2,5-dihydroxycalciferol or calcitriol. Okay, type 2, it is also autosomal recessive condition and it occurs because of mutation in the gene for 1,2,5-dihydroxycholecalciferol receptor. Receptor level पे problem है. Vitamin D? No. Defect at the level of receptor. In other words, what we can say? We can say there is prevention of normal physiological response to 1,2,5-dihydroxycholecalciferol. Okay. So in this form, how can we differentiate between type 1 and type 2? Again, a very important reasoning based question. In type 1, calcitriol level, they will not be much increased. But in type 2, calcitriol levels are higher. But problem is at the level of receptor. So we cannot see the response to vitamin D. Okay, so that is the main factor to differentiate between type 1 and type 2. Level of calcitriol or 1,2,5-dihydroxycholecalciferol. They will be higher in case of type 2, not in case of type 1. Next is vitamin D resistant rickets. It is X-linked dominant form, also called as familial hypophosphatemic rickets. In this condition, bones they become painfully soft and they get bent easily. What is the reason? Mutation in gene in bone and dentin mineralization and renal phosphate absorption. The gene that is involved in bone and dentin mineralization and renal phosphate absorption, it is mutated. Okay, so how it differs from most of the cases of rickets in that intake of vitamin D doesn't cause any improvement in this case. Okay, and males and females both are affected, though males have less severe skeletal changes as compared to males. How can we treat the condition? Okay, now again the treatment depends whether rickets is vitamin D dependent or it is independent. If it is vitamin D dependent rickets, it can be treated with vitamin D. You can see over here, we can give vitamin D. But in case of vitamin D resistant, okay, the response of treatment is monitored, and if it is not responding, that means it is vitamin D resistant rickets. There is no role of vitamin D in that. Next is osteomalacia. Osteomalacia, what does it mean? Adult rickets, बच्चों में जो होता है rickets, बड़ों में जो होता है deficiency of vitamin D in adults, causing softening of the bones. It is osteomalacia. Okay, so commonly it is seen where there is lack of exposure to sunlight. Okay, the females who remain indoor, they can experience osteomalacia. Clinical features, person may experience pain in the different parts of body. They can suffer from difficulty in getting up from the bed, waddling gait, carpopedal spasm, obstetric hand. What is obstetric hand? How the obstetricians they do? Pelvic examination, flexion at the metacarpophalangeal joint and extension at the interphalangeal joint. Along with there is a position of thumb. Okay, obstetric hand bolte kyun hai? This is the way obstetricians they do the pelvic examination. Okay, regarding treatment, exposure to sunlight, okay, and vitamin D administration, it can cure the condition.